Welcome back. I'm an emergency doctor actively working at the emergency department of my hospital. In this Doctor's Corner series, we'll dive into lesser-known approaches and hidden strategies to help the people with critical illnesses. You can subscribe if you want to learn the latest news and healthy solutions about your health. Good health does not always begin with a complicated intervention. Sometimes begin with the simplest variable in the room, water. Now ask yourself this. Why can a person sleep, eat, rest, and still feel drained? Why can the body feel heavy before the day has even started? And how can something as ordinary as drinking water influence a condition as exhausting as chronic fatigue? Let's be clear from the start. Drinking water is not a cure for chronic fatigue syndrome, myalgic encephalomyelitis, anemia, thyroid disease, depression, sleep apnea, autoimmune illness, infection, medication side effects, or any other medical cause of long-lasting exhaustion. Do not reduce chronic fatigue to just drink more water. That would be medically careless, but do not underestimate hydration either. Water is not simply a beverage. It is part of blood volume, circulation, temperature control, kidney function, nerve signaling, digestion, oxygen delivery, and brain performance. When water intake is low, the body does not always announce it dramatically. It may whisper through symptoms: heavier limbs, brain fog, headache, dizziness on standing, palpitations, constipation, poor concentration, irritability, and that deep, flat feeling people often describe as, "I just have no energy." So today, look at water not as a wellness slogan, but as a physiological tool. Ask, why does hydration matter in fatigue? How does it work? When is it helpful? And how should it be used safely? Medical guidance from the CDC recognizes that people with ME/CFS can experience orthostatic intolerance, symptoms such as dizziness, racing heart, or feeling worse when upright, and notes that if salt and fluid intake are inadequate, increasing both may help some patients, while also warning that this is not appropriate for everyone, especially people with hypertension, kidney failure, or heart failure. NICE guidance also emphasizes that orthostatic intolerance and autonomic dysfunction can be part of ME/CFS, including dizziness, palpitations, fainting, and nausea when sitting or standing upright. So listen carefully. If chronic fatigue is part of your life, do not only ask, "Am I tired?" Ask a sharper question. Is my circulation underfilled, my brain undersupported, and my nervous system working harder than it needs to? That is where water becomes important. First, understand the circulation story. When you stand up, gravity pulls blood toward the lower body. A healthy autonomic nervous system responds within seconds. Blood vessels tighten, heart rate adjusts, blood returns upward. The brain keeps receiving enough blood flow, and you continue standing without thinking about it. But what happens when that system is strained? Ask, why do some people with chronic fatigue feel worse while standing in line, taking a shower, cooking, or sitting upright for too long? Why do they suddenly need to lie down? One reason is orthostatic intolerance. The body may struggle to maintain stable blood flow to the brain while upright. The person may not faint, but they may feel internally drained, foggy, shaky, nauseated, breathless, or weak. A 2025 systematic review focused on ME/CFS and orthostatic intolerance examined cerebral blood flow findings, reflecting how central the brain circulation connection has become in understanding upright symptoms in this illness. Now bring water into this. Water helps maintain plasma volume, the fluid part of blood. More adequate fluid intake can support venous return, meaning more blood returns to the heart. Better return can support stroke volume, the amount of blood the heart pumps with each beat. If the heart does not have to compensate as aggressively, some people may feel less pounding, less lightheadedness, and less upright exhaustion. How does this become practical? Do this. Observe your fatigue pattern. Do you feel worse after standing? After a hot shower? After sweating? After coffee without food? After long gaps without fluids? After waking up? If yes, hydration may be one modifiable factor. There is also a fast mechanism that many people have never heard explained. Drinking water can produce a pressor response in some individuals, meaning blood pressure may rise after water intake through autonomic reflex pathways. In a clinical study published in the American Journal of Medicine, researchers examined water drinking as a practical approach for orthostatic syndromes, including severe orthostatic hypertension and orthostatic tachycardia. Pause on that. Water is not only replacing fluid over hours, in some contexts it can act more like a short-term circulatory signal. So ask, how should you use this? If you often feel worse in the morning, do not wait until noon to hydrate. Begin earlier, keep water near the bed, sit up slowly, drink before the first demanding task. If you feel worse before showering, drink beforehand. If standing in the kitchen drains you, hydrate before cooking. Use water deliberately, not randomly. Second, understand the brain story. The brain is sensitive to small changes in hydration, not because it is fragile, but because it is electrically active, metabolically demanding, and dependent on stable blood flow and electrolyte balance. Ask, why does mild dehydration feel like mental fatigue before it feels like thirst? Because thirst is not always an early warning system. Some people, especially during busy days, illness, stress, aging, medication use, or low appetite, may drink too little without noticing. Controlled research has shown that mild dehydration can affect mood, fatigue, concentration, and perceived task difficulty. In young women, mild dehydration was associated with worse vigor, higher fatigue inertia, greater total mood disturbance, more headache, and more difficulty concentrating. In young men, mild dehydration was associated with poorer vigilance and working memory, and increased fatigue and tension. This matters because chronic fatigue is not only about muscles, it is also about the felt cost of thinking. Reading an email may feel like lifting furniture. Answering a message may require recovery. A conversation may feel neurologically expensive, so ask, how can water help here? By reducing one avoidable burden. If dehydration is adding even a small layer of cognitive strain, correcting it may not solve the whole condition, but it can remove a weight from the system. Think of it this way. When the body is already operating with limited energy, even a small avoidable stressor becomes meaningful. A PLOS-only intervention study found that among people who habitually drank low amounts of water, increasing daily water intake significantly reduced fatigue inertia, confusion bewilderment, and thirst. That is important because the benefit was not based on extreme dehydration. It was about changing everyday intake patterns. So do not ask only, will water cure fatigue? Ask a better question. Is low water intake making my fatigue louder than it has to be? Third, understand the kidney and hormone story. When you do not drink enough, your body protects you. The kidneys conserve water. Antidiuretic hormone rises. Urine becomes darker and more concentrated. The body narrows its options to maintain blood pressure and fluid balance. That protection is intelligent, but it is not free. Ask, how much effort is the body spending just to preserve fluid? How much of that hidden effort contributes to the sensation of being slowed down? The national academies set adequate intake levels for total water to help prevent acute negative effects of dehydration, including metabolic and functional abnormalities. For adults, the often cited values are about 3.7 litres per day of total water for men and 2.7 litres per day for women, including water from foods and all beverages, not just plain drinking water. Around 1/5 of total water commonly comes from food. Now be careful. Do not turn these numbers into a rigid command for everybody. Needs vary with body size, heat, sweating, fever, diarrhea, pregnancy, breastfeeding, medications, kidney function, heart function, diet, caffeine, alcohol, and activity level. Instead, use the numbers as a compass. Do this. Track your intake for 3 days. Do not guess. Measure. Many people who say, "I drink water all day," discover they are drinking only a few cups. Others discover they are drinking large amounts of plain water but not retaining it well because their salt intake, meals, or medical condition affects fluid balance. Fourth, understand the electrolyte story. Water works best when the body can hold it in the right compartments. Sodium helps maintain extracellular fluid volume. That is why, in some people with orthostatic intolerance, clinicians may recommend not only fluids but also salt, if it is medically safe. Ask, why does plain water sometimes seem to go straight through? Because fluid balance is not just about pouring water into the body. It is about absorption, retention, blood volume, kidney signaling, and electrolytes. But listen carefully. Do not increase salt aggressively without medical guidance if you have high blood pressure, kidney disease, heart failure, swelling, liver disease, or are taking medications that affect sodium or fluid balance. The CDC specifically warns that increased salt and fluid strategies are contraindicated in certain conditions such as hypertension, renal failure, and congestive heart failure, so make the plan intelligent. If fatigue comes with dizziness on standing, rapid heartbeat, faintness, or feeling worse upright, tell a healthcare professional. Ask about orthostatic vital signs. Ask whether POTS, orthostatic hypertension, anemia, thyroid disease, adrenal issues, medication effects, or dehydration could be involved. Do not self-diagnose. Test the pattern. Fifth, learn how to drink water in a way that actually serves the day. Do not simply say, drink more. That is too vague. Use structure. Start with the morning. After waking, drink a moderate amount of water before caffeine. Why? Because overnight fluid losses happen through breathing, sweating, and urine production. Morning is when many people with fatigue and orthostatic symptoms feel especially depleted. Next, pair water with transitions. Drink before standing for long periods. Drink before leaving the house. Drink before a shower. Drink before mentally demanding work. Drink after sweating. Drink with meals. Put water where decisions happen. Desk, bedside, car, kitchen counter, bag. Then watch the body's feedback. Look at urine colour, but do not obsess. Pale yellow often suggests reasonable hydration. Consistently dark urine may suggest low intake, though vitamins, medications, and foods can change colour. Notice headaches, dry mouth, constipation, dizziness, afternoon crashes, and heart pounding. Notice whether symptoms improve when hydration is steady for several days. Do this for 1 week. Keep a small log. Write down sleep, water intake, caffeine, meals, standing symptoms, urine colour, and fatigue intensity. Why? Because patterns that feel invisible often become obvious on paper. Now ask, how much should you drink at once? For many people, small, steady doses are better tolerated than suddenly forcing huge amounts. Try a glass in the morning, a glass with each meal, and additional water between meals. If orthostatic symptoms are prominent, some clinicians use a larger water bolus before upright stress, but individual tolerance matters. Do not overdo it. Too much water too quickly can dilute sodium and cause harm, especially in vulnerable people. Also, do not let water replace food. Chronic fatigue can worsen when people drink but undereat. The body needs fluid, yes, but also protein, carbohydrates, fats, vitamins, minerals, and salt in appropriate amounts. Hydration supports metabolism. It does not substitute for nutrition. Sixth, keep the promise realistic. Water may help fatigue in several ways, supporting blood volume, reducing orthostatic strain, improving concentration when intake is low, decreasing headache tendency related to dehydration, supporting bowel function, and reducing the physiological stress of fluid conservation. But if fatigue is severe, new, worsening, or associated with chest pain, shortness of breath, fainting, fever, weight loss, blood loss, neurological symptoms, severe depression, or inability to function, seek medical care. Do not cover warning signs with water. Ask, why is this distinction important? Because good health advice must be powerful and humble at the same time. Water is foundational, but it is not a diagnostic workup. It can support the body while you investigate deeper causes. So here is the message. When chronic fatigue is present, drinking water is not a magic answer, but it can be a meaningful intervention when used with precision. Do not treat hydration as background noise. Bring it forward, measure it, time it, pair it with meals, use it before upright stress, respect electrolytes, watch your symptoms, ask better questions. Why might water help? Because fatigue often worsens when circulation, brain function, autonomic regulation, and fluid balance are under strain. How might water help? By supporting plasma volume, improving tolerance to standing in some people, reducing mild dehydration-related fatigue and brain fog, and lowering the body's hidden workload. Begin simply, drink earlier, drink steadily, and observe honestly. If you have medical conditions that affect the heart, kidneys, blood pressure, or sodium balance, get guidance before making major changes. And remember this. Sometimes the body does not need a dramatic rescue first. Sometimes it needs the basics done consistently, intelligently, and with respect. Take care of yourself, take care of one another, and let's keep learning like a family that wants everyone at the table to feel stronger. See you in the next topic.